The number of coronavirus cases across the country shows no signs of slowing down. State officials are sounding the alarm with warnings that healthcare workers face a dwindling number of supplies to protect themselves on the front lines.
Joining us right now is Eileen Sullivan-Marks, who's a dean of NYU Rory Myers College of Nursing and the president of the American Academy of Nursing. Thank you so much for being here, Dean Eileen. Walk us through for a second here what a typical day is like for the doctors and, of course, the nurses who are fighting on the front lines of this pandemic.
Well, one thing I think the doctors, the nurses, pharmacists, respiratory therapists, everybody is all in. They want to be there to help, and they know that they need to take care of themselves in order to stay healthy to do that. I've been talking with some of my recent alumni from the College of Nursing who are in emergency rooms, who are elsewhere, and they are like, this is what you prepared us for, this is what we want to be doing. However, we want to stay healthy, and we want to have all of the equipment that we need to stay healthy so we can continue to care for others. And that's why you hear in different situations problems with, well, we've looked in the closet and do we have enough? Hospitals, as I mentioned last week, are preparing well ahead. But if you look at what we might need within 2 weeks, particularly in places like New York City, San Francisco, other places that have increasing numbers on that curve we talk about, they're like, do we have enough? And this week you heard things like cries for, please send us anything you have. All of the schools of nursing, schools of medicine around the country who have equipment for teaching in our simulation centers, we've emptied that out. We delivered it all to the hospital, and that's happening around the country. But that doesn't mean that everything is logistically prepared. I understand the governor in New York says that now there's going to be a huge supply of N95 masks. I saw that on the website this morning. And we're around the country, there probably are available equipment, but we need more. We probably need a much more federal response to this now so that we have the supplies we need, probably coming from relationships to other countries, and as well as what can we release from our federal U.S. Public Health Service Commission core supplies, or the staff that we need, as well as the military.
I found this interesting because you're right there on the front lines, as we mentioned, and President Trump just yesterday said that he has not used the Defense Production Act to try to ramp up productions of masks, the gowns, the PPE stuff, the gear that you guys need. Do you think he should?
Well, we met with President Trump, the nursing organizations, last week, about a dozen or more of the leading leaders of those organizations, and expressed our need for this equipment and the need for it to be distributed appropriately. I think he heard us. But we also met with other federal leaders from CMS, Vice President Pence, to really emphasize the nurses are the front line. We are the treatments, because when you have a nurse at the bedside with the most sick patients, that nurse is the one who's there 24/7, and you need more of us than anyone else because we're with you 24/7. So whether or not we start to see a federal effort to say make this or make that, we'll wait and see, but that's what we need.
And reports of some healthcare workers who are actually reusing their PPE. Dean Eileen Sullivan-Marks, thanks for coming on and telling us what your colleagues need.
You're welcome.